So let's begin this particular video, and from the video that we have left uh, here, we actually highlighted and told you the fact that 2021 there will be NEET PG, and right now after 7 days, most of you must be aware of the fact. Now, as per my calculation and all the informations from Delhi, 2022 is little dicey, and there is high probability that 2022 can be NEET PG only. It will depend upon many factors, and few factors that you can control, few factors not in our control at this point of time. 2023, as per as recent proposal that is being circulated by Indian Medical Association, it is going to be next PG, and the whole format we have already discussed in our last video that you most probably have checked out. So if you haven't, please check that out. But one thing I should tell you, till now it is just proposed, it have not been passed totally. It is just a proposed one. It is not being entirely passed. So at this point of time, you should only think about NEET PG. This is actually proposed. Only one certainty is here, that next year it is going to be NEET PG. This is the only one certainty. Now all the query came to me, and after that I realized the only confusion is not here. Confusion are elsewhere too. Like the people, there are two kind of people at this point of time broadly. The people who have been selected and got the requisite marks to be qualified for NEET PG, the qualifiers, so called the qualifiers, and a large chunk of them are at ODU, and another part are who haven't got the qualification marks. But only good side about them is they know they have one target, that is 2020 to 21, and they will go for whole hog. Already they have started for NEET and AIMS and GPMR and PGI. 2020 to 2021, they will go for all those examinations, and they know 2021 is their crucial year, as because changes, though it's not finalized yet, but may start to happen from 2021. So from the people who are being selected, are they have anything to worry? Yes, they are actually more worried than those persons who are not selected. Like here 90,000 people, almost 90,000 people who are not selected, they know that they have one examination which they have to go for within a year time, 10 months time. And those persons who are being selected, they actually, out of them, you can take around 10%. 10% means those people are getting a rank within 10,000, and I am here strictly mentioning the general category and non-service. So they know they will get some clinical. Now the rest of the students who are qualified, but in little bit dicey. There are section of student, and the major worrisome things are facing by the people who are in the range from 10 to 30,000. There we can categorize them by two particular column. One are 10 to 20,000, another are 21 to 30,000. And again, I'm reiterating here, I am also talking about non-service unreserved. Okay, so general category. Now this particular chunk have a pretty good chances of getting some clinical from the last round of counseling from all the factors like the DNB, the state quota, the all India quota. They can get and later the rank is lesser are the chances. Later is the rank, also lesser are the chances. This is the directly proportional interrelationship. Here also they might get in some states in the final counseling, they might get some clinical seats, but not in all the states. So there is the state variation is going to make a huge impact out here. Number two, here the latter half like 25 to 30,000, then there will be entrant of the paraclinical subject like pathology, which is the most sought after subject, and the subjects like radiotherapy, because few people think that there will be oncology cases, so they need the radiation treatment, so they consider radiotherapy as a clinical line. It has its own flip side too, but that I'll tell later, might be in the some other video. So top 10,000 mostly will get all the subjects. It will vary from the state to state and everything, but apart from radiology, to an extent dermatology, they will most probably get all the major subjects, clinical subjects, and lesser chances of medicinal medicine. But rest of the subject, rest of the major clinical subject they will get. 10 to 20,000. Again, they will get the other subjects like anesthesiology, radiotherapy, NS, radiotherapy, they good chances they are going to get these subjects. Now the challenges are actually happening for the people who are afterwards, after this 30,000 to 70,000, and mark my word, 30,000 to 70,000, it will vary again from state to state, but they will get some seat or other after the final counseling if they want to go for that. They will get pre and paraclinical subjects. So once they are going to get the pre and paraclinical subjects, then where the problem lies? They have their own set of problems. Number one of it society will not consider them as a doctor. They will not be considered as doctor. Number two, they will lost all the clinical touch for which they have actually worked for more than a decade. Number three, many of them are worked more than a decade. Number three, the emolument, their earning potential with passing time is going to be less and less. Earning potential is going to be less and less. Even a MBBS, just a MBBS, who is practicing in the rural side and seeing 10 patients and referring to different surgical cases, their total consolidated earning is going to be equal or more than a person who is doing their MD or MS even in the best of the colleges in Delhi, maybe 5 years down the line, because the earning potential is always go with the clinical subjects. People have their risk, obviously they have their flip side, their life work balance is going to be deranged. They have a lot of pressure, they have their legal issues, but yet the earning potential wise a paraclinical subject will not be able to match a clinical subject. That is the fact, and however good way one tries to put it, but it cannot be matched. Even a MBBS who is working in a CHC level in certain states, their earning for sure is going to be more than MD, MS professors or assistant professors in a government medical college, and also sometimes in those who are working in the central government medical college. So this way you understand that flip side is there. If you have to inquire it. The fact is that once you are going to settle for a clinical or a paraclinical or preclinical subject, you have to be very honest and face yourself that in rest of your life you will not be considered as a doctor, and more time passes by the time you are going to finish your MD, you will not be considered as a doctor and your clinical acumen is going to get lost. That is the true fact. So you have to decide if you are getting this rank even from the 20 to 70,000, whether you are settled with that or not. That is the answer that you have to own yourself, you have to come up with. Now, one question also came, what is the difference and positive and negatives between the government medical college and private medical college? And here also I'm just mentioning the positive side in each. Government medical college and private medical college. See, there is no question if you can afford and if you got a rank of 30,000 plus and you are getting a clinical seat, you should go for it. Number two, you don't have to, after completion of your PG courses, you don't have to go for a bond. There is no bond out here. There is no James Bond. So that is a huge impact in the equation. It's a boundless bounty, because if you are doing the subjects like general medicine and general surgery, where you have to go for super specialty courses, in that particular scenario, that 3 to 5 years bond time will take a lot of fire out of you. There is no guarantee that you will come back with the same vigor and going to crack it again, because 5 years is a huge time. You have seen how the pattern is changing every time. So if you can afford, you go for the private medical college. If you can afford, it's not everybody's cup of tea. Everybody cannot have that luxury, but if you can afford, you can go for it. Number 3, like subjects like radio diagnosis and after we have already uploaded the video of Hyperfine, which is going to be first FDA approved portable MRI machine. So once the portable MRI machine is there, so you can understand MRI is going to be get into the PhD level, not PhD, if not PhD, CHC level at least. So more radiology jobs are going to be there. More radiology jobs. So the fear that artificial intelligence is going to take the job of a radiologist is not going to be true anymore. In India, it is going to be not for at least a decade. At least a decade is not going to happen. Like you know, the 4G connection speed is not equal in Delhi and Darbhanga. So you understand, Delhi and Darbhanga 4G speeds are not equal, and that is why artificial intelligence and all the teleradiotherapy is not going to work the way it could have in India, at least for a decade. So there are good chances there will be increasing number of super specialty courses in upcoming days in the radiology too, and chief of them is neuroradiology and interventional radiology. So this is the way things are going to span out: neuroradiology and interventional radiology, because it is going to diagnose the condition earlier, both the stroke cases and the white matter disease, and it is going to be severe in the cases of strokes. So this is the positive side of getting into a private medical college, because the leading private medical colleges like Manipal have the base standard of machines in terms of MRI machines. So there you don't have to compromise with the learning. Like if you go to a temporary allowed seat in government medical college, you are not sure that MRI machines are always there. Just like in a radiotherapy course, you will, if you are not have a LINAC machine, so it is going to be very, very difficult to practice after passing out and in a private hospital. So these are the positive side of the private medical college. Now, what are the positive sides of a government medical college? Number 1, you will have a tremendous amount of patient load. Patients number and the different cases are always going to be there in the government medical college. For the surgery, you will have the chances to do more cases. That is for certain. Number 3, you will get your stipend, whatever be the amount, and hopefully it is going to rise pan India. because doctors' stipend are very less, and it is inexplicable in an era where Ola and Uber drivers are earning 20 to 40,000. The interns are not getting 40,000. The highest is 23,000, which is in AIMS at this point of time. So it should go up. I hope that concerned government is going to take a call on that. Number 4, after your PG, here the flip sides are coming, as we have already said. There is no bond here, but here you have to go for the bond. Bond is there, and you know you are going to be, depending upon the subject, in the CHC level, hospital, and the condition and the number of patients, all the technique and technology that you will learn, whether you are going to be able to implement those. These are the question factors are going to be there. But huge important thing, and the prestige of studying in a government medical college is unmatched. It actually equated with the intellect and intelligence. If you tell your family that I'm studying in Calcutta Medical College, or you're telling I'm studying in a VAMC or Madras Medical College or KEM Mumbai, so in those parts the respect is far higher. So this is the very basic fact what you will see, and you have to take a call whether you can afford. Not everybody can afford, but if you can afford, and so you will save your 3 to 5 years. So these are the factors you should keep in mind. I'm just giving you the information. I'm not suggesting anything. Everything is your own decision. You are a doctor, and you will see a patient. Patient will come to you, and you have to take a call. And hopefully this particular